The FDA released a proposed rule on November 1st under which they will recognise accreditation bodies who will in turn accredit laboratories to conduct food testing. The proposed programme incorporates elements of ISO IEC 17011-2017 and ISO IEC 17025-2017 as requirements for accreditation bodies and laboratories. It is proposed that the accredited laboratory will send results directly to the FDA and a full test report will be required unless the testing laboratory has been approved for abridged reports. Comments are open until March 3rd, 2020, and the programme will be effective 60 days after a final rule is published. However, the FDA has reserved an unspecified period of time to allow itself to prepare for the changes and ensure sufficient laboratory capacity. This means that there is a likelihood that mandatory testing by accredited laboratories may still be a few years away. The FDA has announced it will utilise microbial testing for pathogens in romaine lettuce following several outbreaks in the last 2 years. These tests will focus on Salmonella species and E. coli and are intended to take a full year, concluding next November 2020. The FDA have said it will maintain its enforcement discretion for certain supply chain program requirements that are applicable to contract manufacturers. This discretion is currently in place as a response to brand owners performing certain supply chain requirements on behalf of their co-manufacturers and was due to expire earlier this November. However, currently the FDA have not announced when this extension will expire. This month, Germany has followed in the wake of the European Commission's ruling earlier this year to classify cannabis oil as a novel food. This means that no CBD-containing product can be marketed in the country without prior authorization. German authorities have admitted mistakes were made in its investigations into a listeria outbreak between 2014 to 2017, only identifying it as such last year due to advances in whole genome sequencing. They have since agreed to increases in food monitoring and unannounced inspections with technical supervision, as well as a review of how businesses conduct their self-control systems. The company at the source of the outbreak has ceased production in early October and has since filed for bankruptcy. Malaysia, the world's second biggest producer of palm oil behind only Indonesia, have taken measures to ensure its palm oil output will meet potential new EU food safety standards by 2021. The EU is currently considering new limits on food contaminants in refined fats and oils, which would affect 3 MCPD esters found in palm oil. Following the trend of environmental concern, elsewhere the World Wildlife Fund has called on UK political parties to pursue legislation which will aim to eliminate deforestation in the food and drink supply chain. The call follows the release of findings which show that Brazilian Amazon deforestation has risen by 29.5% in year-on-year comparisons. The US Department of Labor Research has revealed that injuries and illnesses among workers in the US meat and poultry processing industry is at an all-time industry low, having fallen to just 4.3 cases per 100 full-time workers per year. China has lifted its ban on importing US poultry, which has been in place since an avian influenza outbreak in January 2015. The lifting of the ban was quickly followed by news that 172 US poultry processing plants have been approved for export to China. The previous full measure taken of US poultry exports to China show that in 2013 the market was worth $500 million to the US economy, and speculators now claim that the renewed trade could be worth up to $2 billion following a perceived meat protein deficiency due to African swine fever. China has also lifted its temporary suspension on imports of Canadian beef and pork products. The ban has been in place while an investigation was carried out into the potential counterfeit certificates between the two countries, and its lifting has been welcomed by the Canadian Meat Council. New research claims that the number of people affected by listeriosis in mainland China has been underestimated. The study reports that 562 infections are said to have occurred in the 6 years between 2011 to 2017, opposed to a total of 229 cases in the period of 1964 and 2010. As of yet, there is no evidence of an outbreak, though there is potential risk of listeriosis in the Chinese population. Scientists have called for the introduction of a comprehensive monitoring system for listeria infections, saying that it is urgently needed. This has been your November Food Safety Industry Roundup video, and thank you for watching. Please remember to click the like or subscribe button to make sure that you get each video in this series, and to stay informed of all the latest content that Safety360 publishes, which includes our detailed blogs, data sheets, and white papers. Each industry roundup has a full transcript and links for more detailed reading, which can be accessed at the link below. But if you would like to know more information about how food businesses globally are using Safety360 to meet and manage and maintain their food safety and supplier quality management demands, please visit safety360.com for more information or leave a message below.